the hospital has reached a crisis point. I think there's a general consensus that enough is enough. There's a lot of people who would like to speak out and talk, but feel hamstrung by their obligations as employees of New South Wales Health. So I think we can tuck it in there and just...
In early 2024, Rob Knox stumbled upon a discrepancy with the way some of his cancer patients had been allocated their surgery at Orange Hospital. He'd assigned them the highest clinical priority, which is Category 1, meaning their surgeries were to be done within 30 days.
When I rocked up on the day, in January, I've seen a different category against these patients' name, and so I've questioned management and said, well, hang on, what's happened here? At no stage did we agree to amend the clinical urgency of these cancer patients.
As the director of the hospital's surgical department, he soon discovered colleagues had had similar experiences. They were being asked by management to lower the urgency of their cancer patients' surgeries so they could be done outside the recommended 30-day timeframe.
They've been asking us to amend these clinical categories on several occasions because of lack of availability of resourcing. We politely declined. But even then they seem to have been changed on the order of administration for reasons that I can only presume are because that they don't want them to appear in the waitlist statistics.
The hospital's requests include asking a surgeon to classify a patient as not ready for care so they didn't breach their waiting time. Another was contacted to see if they could change a person's 30-day waiting period to 90 days because there was no theatre space.
Once that clinical urgency has been assigned by the treating clinician, that clinical urgency category should only be changed because there's a change in the patient's clinical condition. The policy is quite clear for that it should not be influenced by the availability of hospital or resources or even the surgeon's availability. If she's still there in a couple of days and we haven't managed to get her...
Rob Knox initially thought the changes being made by hospital management were mistakes.
...and see what we can do. When directly challenging senior management and they've dug in their heels and they've said, actually, no, we're allowed to do this, then that's where we decided there's a real problem. The reality is, cancer doesn't know what time it is or what day of the week it is. It's growing, so you want to be able to do it as quickly as possible. It's very hard to say that a delay of 1 to 2 to 5 days makes a difference, but undoubtedly, on a broader level it does, and to one individual it is going to make a difference. Not to mention the anxiety and the stress of living with cancer that you know is growing inside of you and you're awaiting treatment of it.
Puppies, come here, hello. Hi.
One of the patients who faced an anxious wait was Katrina Reeses.
I found a breast lump. I went and saw my GP and had an ultrasound and a mammogram done. From there I was diagnosed with triple-negative breast cancer and referred to a surgeon. These letters here are just from the Cancer Care Centre here in Orange.
This was in 2024.
I was given a Category 1 booking form, which is the highest urgency category for my surgery to be done.
Katrina Reeses had worked in the hospital's surgery admissions office for 19 years before leaving in 2021. She was still familiar with the process and expected to receive her surgery date within days of handing in her booking form. She was still waiting more than a week later.
I was starting to get concerned because we were coming up to the Christmas closure time as well. So I was really worried that I wasn't going to be getting my surgery within the 30-day period.
Katrina rang her surgeon, who intervened.
Because I knew the policy so well and I knew how the system should have worked and I knew that it didn't work for me, I was able to advocate for myself. There would be a lot of vulnerable patients out there that just trust the system, that they trust that the hospital is doing the best thing for them. And in most instances, the hospital is doing the best for them. But there are those times where I think there's a bit of a failure.
Katrina Reeses' surgery was done on time last December, and she's now cancer-free. Claire Whelan is one of 2 urological surgeons at the hospital. She was the director of surgery before Rob Knox and shares his concerns for cancer patients.
Sometimes it becomes really difficult, particularly when we are talking about those cancer patients, to say, well, I can't pick that one of these cancers is going to be more urgent than the other, because sometimes we don't know that until after the event.
She says some of their patients have waited months for surgery.
We certainly had examples of patients towards the end of last year who removed themselves from the public hospital waiting list, and what the hospital sees is great, those patients no longer need their operation. But what we know is that this is patients who have accessed their super funds to be able to pay $10,000 to have their operation done. You know, having been booked onto the theatre list in August with no sign of a date in December, and then the prospect of no operation till March, you can see how they felt they had no choice.
Dr Knox says access to operating theatres is partly to blame for the delays.
We've had 15 empty theatre sessions, which is about 4% capacity. Now, if you look at the waitlist numbers, if we'd funded and staffed those and used those, we would have cleared the waitlist.
They've also experienced pushback from management to hire more surgeons.
The explanation that was given was that, no, you will generate too much demand. Now, obviously we're not generating pathology out there in the community. We're not walking around with ray guns zapping people to try and generate pathology. The obvious meaning of that is that we will generate a wait list of patients that then becomes the hospital's liability to deal with.
I want to be clear, that shouldn't be happening. That's against clinical guidelines. We have a framework in place. My advice is that hospital and the staff have been following that. If there are issues where that has not been the case, then I'd want them investigated and have a look at. What we expect is patients' clinical care to be first, second and third KPI. That's what I expect as the Health Minister.
The Orange Health Service declined 730's request for an interview. In a statement, a spokesperson for the Western Local Health District said it rejects claims that surgeons have been asked to reclassify surgical procedures and prioritise waiting list targets over patient care, and that options described in New South Wales health policy to assist in managing patients within required timeframes are activated where possible, but may be affected by the availability of surgical and other staff and appropriate theatre facilities.
The obvious question is, who benefits from this? It's not patients, it's not clinicians, it's the health system.
Okay. Yeah, right. That's looking better.
I'd like patients to have the hospital that regional Australia deserves, and the need and the opportunity for them to continue to be treated closer to home with as least disruption to themselves and the lives of their carers and loved ones, and continue to receive good clinical care with good outcomes.
Late this evening, the Health Minister's office told 730 that New South Wales Health is now reviewing the re-categorisation of surgeries undertaken at Orange Hospital.